My name is Luke Schellenberger. I'm an ENT doc. So today we're going to talk about how to take care of a bad nosebleed. Everybody gets nosebleeds occasionally, but some people get really bad nosebleeds and they're like, oh my gosh, my nose is just pouring out blood. And that has to do with blood vessels that are right up near the front of the nose. Here's a little graph here. There's tons of blood vessels along a part of the nose called the septum. And when they're right up underneath the lining, and so sometimes they can crack open and bleed, or sometimes patients will be picking their nose and they'll cause one to crack open and bleed. But this is the bleeding at the front of the nose, called an anterior nosebleed, sometimes can be really bad. And if you're having a hard time getting control of it, probably the best thing you can do is to take a cotton ball, and you don't take a whole one, probably take about a half one, and you roll it between your fingers, so it kind of looks like a little football or a little rolled up thing there. And then you soak it with Afrin. Now, I'm not a big fan of consistent use of Afrin, but if you have a bad nosebleed, you just take a cotton ball, you have your Afrin, and you just soak the cotton ball with the Afrin, put that down there, and you put that in your nose, okay? And then you squeeze around it. Now, it's important that you stay with that pressure on that spot for at least 5 minutes. And so I'd set a timer and just kind of keep that squeezed. Don't let it off after a minute to check it or anything. Just set a timer to keep it squeezed for 5 minutes. I don't have a nosebleed, so I'm not going to continue to keep it squeezed. But it's extremely effective, okay? Because Afrin and other nasal decongestant sprays, you can use a generic, but it has to say oxymetazoline or niacin-ephrin. And I've had those written down on a sheet before. But the way that they work is they squeeze blood vessels. Got a bad nosebleed, you got a blood vessel, we want to stop it, we want to squeeze that blood vessel and make it stop. And so that is by far the quickest and easiest way to manage a really bad nosebleed. Now, after 5 minutes, if it's like, oh my gosh, it's still pouring out blood, you may need to give us a call. Sometimes if we can't get you in the clinic quickly, you may have to go to the emergency room. So anyway, but that's a good, easy way to take care of a pretty bad nosebleed in a short period of time. All right?